So without further delay, it's my great pleasure and honor to present Dr. Matt Gillespie. Thank you, Matt.
Thanks, Saul. So I actually got into biomimetics after I was interested in insurance. And I'm going to explain sort of how I got into biomimetics, why I got into it, and how I think biomimetics is at the forefront of the future of dentistry. A big part of this to me was I was a fee-for-service dentist first. When I mean fee-for-service, we're all fee-for-service. We all get paid for the procedures that we do. And as a fee-for-service dentist, I was actually in network with 17 different PPO plans. I purchased my practice in 2012. And when I did that, I realized every year that I was getting busier, I actually was taking home a little bit less money.
Hello. I agree with you. The insurance industry has been vilified, and I feel like dentists that things aren't going well, they love to complain, and the insurance company is an easy punching bag. However, how do you feel about insurance policies like categorically not covering implants, right? Or missing tooth clauses, or like there's certainly certain games that insurance plays that are not patient or dentist friendly. So in the same way at my practice, right, we're out of network. We don't throw the insurance under the bus so much, but when patients are complaining about what their insurance pays for their procedures, or that the insurance is just choosing not to cover this service, how do you dance around that without, throwing the insurance company under the bus?
So I explain insurance is a financial tool. We have to understand the way insurance policies are priced. And so when I first developed my insurance plan, I did this before there was any membership plans out there. And so I started looking into auto loan servicing software, which then led me down to the Society of Actuarial Science rabbit hole. And you have to realize, if you want to pay for an implant, if you want to pay for missing teeth, the more benefits that you give an individual patient, the higher your premiums have to be for the group. So this is when we talk about personal accountability versus societal accountability versus a financial tool. If you didn't do what you did to keep your teeth and you want to have them replaced, is that a personal issue, or is that a societal issue, or is that the plan of benefit? Is how do I know that I'm actually avoiding dental care? I actually take metrics of the number of crowns that I do, the number of bridges that I do, the number of root canals that my patients need, the number of extractions. And that's really what got started this. Is I went from doing 30 to 40 crowns per month down to doing 3. Everyone who does biomimetic dentistry should know this. And then when you do 30 to 40 crowns, then you got to figure out how to charge your fees in an ethical manner. So how do I market myself to attract new patients? A big part of that is word of mouth. I've been here in Tyler for 15 years, and I actually got started on Facebook. I'm going to send this to you. As I was, before everyone posted their work to Instagram, I was posting my work to Facebook. And when I went out of network, I did this in a very methodical way. And I started looking at my PPO reimbursements, and then I looked at how large the reimbursements were. And if you ask, or if you send your email, I will send all this out in slides for you. But I started looking at how much I was giving away and how much I was reducing my fees. But I realized if you do biomimetic dentistry, you don't have to reduce your fees. You're reducing the volume of treatment necessary. So I started doing a lot of free second opinions for PPO patients. And when I did that, I'd get a patient that was told they needed a root canal, buildup, and crown. So in a PPO office, you're talking about, $600 to $800 for the root canal, $600 to $800 for the crown, $200 for the buildup. And I was charging $500 to $600 for a direct composite restoration. But when I first went into this, I time myself for everything, whether it's an exam, whether it's a cleaning, whether it's a direct composite, one surface, a sealant to an onlay. And I did this for about 8 months. And after I did that for 8 months, then I completely recalibrated my fee schedule in order to be paid just as much for a sealant as I am for an onlay, as I am for the extraction, as I am for the partial, as I am for the implant. And this allowed me to present treatment to my patients without having any unconscious bias from a financial point of view. And many times, a lot of my patients will tell me that they don't feel like I'm selling them treatment, and I'll tell them, well, I don't need to upsell you any treatment because I get paid just as much for the consult as I do to do the work. And sometimes patients will complain about, well, why are your exams so expensive? And I say, well, you're using my time, and my time is the most valuable aspect of my dental practice. And if you're using my time, I can either charge you more for not cutting on you or charge you more for cutting on you. And I would prefer to charge you the same so I can get paid just as much for not cutting on you. And patients understand this inherently. And if I can save them tooth structure, they're more than willing to pay for that through my membership plan, or even through my hourly rate. I do a lot of second opinions. I even do second opinions for a lot of the specialists around town and say, hey, you know, this doctor told me I needed a root canal. I'd really like to avoid it. I can't do it all the time, but if I can, this is what it looks like. And if I can't, I send you to the appropriate avenues, because that is what I'm doing, is I'm charging you for my expertise. So that's what I want you to think about as a biomimetic dentist, is that your time is valuable no matter what procedure that you're doing. And you really want to calibrate your fee schedule to ensure that you're not wasting time on certain procedures. And if you are, you're inherently not going to do them.